good afternoon, everybody. I've got an amazing panel that will be talking to us today, and we'll start with just introducing myself. I'm Craig Elliott, Executive Chef at Unilever Food Solutions. I have first on my list is Pinky MARUPING. She works for Unilever in Johannesburg. Pinky, do you want to just introduce yourself quickly to our audience?
Hi everybody, my name is Chef Pinky MARUPING and I am the Regional Customer Chef for Unilever Food Solutions in Johannesburg. And I usually get into contact with a lot of chefs in the industry, and I am also a director at SA Chefs Association.
Then we have HEIDI HECKMANN as well, if you could just introduce yourself.
Hi there everyone, my name is Chef HEIDI HECKMANN and I am situated in the beautiful mother city in Cape Town, and I look after the Unilever Food Solutions kitchen in the Western Cape.
Then we have Claire Newton, if you'd like to introduce yourself please.
Yes, so I'm Claire Newton and I am a psychologist in private practice. I'm a professional speaker, a trainer, a business and life coach, and a hat lover. My consulting room is at my home in Kloof, which is a suburb of Durban, but I also have an online practice with clients all over the world. I work with individuals and with corporate companies, and I assist them with mental health issues as well as interpersonal skills, communication skills, and emotional intelligence issues.
And last but not least, we have Anne RAJCOOMAR. If you could introduce yourself, please.
Hi everyone, I'm Anne RAJCOOMAR and I'm a senior counselor at SADAG, the South African Depression and Anxiety Group. I'm also one of the trainers and I've been involved with SADAG for approximately 8 years. I come from a speech and hearing therapy background as well as an industrial psychology background. I've had over 20 years of HR management experience as well as working in the employee assistance program field. And I've also been involved in various research projects with SADAG when it comes to school programs, employee assistance, governance in terms of corporate culture, and how to develop mental health campaigns within the different corporates.
So let's kick off. I just want to set the tone a little bit regarding the COVID-19 and the current situation we're in. I look at our hotels that are closed, restaurants that are starting to reopen slowly. The guys are definitely, I get phone calls on a daily basis, people that don't have work, there's people that have been retrenched, there's people sitting at home being idle, their minds, their anxiety is picking up, depression is obviously setting in certain areas. I'd like just, Pinky, if you could just give us a little brief, what are the chefs feeling in Johannesburg and what are they doing? What's happening in the current situation?
I get into contact with a lot of chefs in the industry, and what I see is a lot of hopelessness. They lost hope. Some of them have lost their jobs. Some of them, when I speak to them, they have mood swings, they are sad. Some of them, they are anxious because they don't know what is going to happen tomorrow. When is the lockdown going to be lifted? And some of them, when the restaurants open and the hotels, how are they going to start working? Are they going to get retrenched? Is their salary going to be cut? Some of them have like a social isolation. They don't want to speak to a lot of people, and I find that I get difficulty in calling people and them answering their phones. So most of them, I end up WhatsApping them, because then they are, on the other hand, they are not face to face with you. Then it's easier for them to tell you how they feel and how they are going. But I found that some of them don't always feel comfortable admitting that they are depressed or there's something wrong or they don't feel normal. So, that lack of ability to see or notice the realities of one's condition is affecting them, because I think once you admit that you're not feeling well, you need help, then you will never get out of that hole. So that's why we're saying to people, to them, we trying to reach out and saying there is support system. Dial the Fair Kitchens and SADAG number. It's confidential. Nobody's going to judge you, whether you wanna cry, whether you wanna. It's your journey to heal. So we always encourage them to call that number.
Heidi, I'll ask you what experiences you've had. I know you've been calling a lot of the chefs in the industry and vice versa. Just give us some situations that are currently happening and that are real, and it's happening to people we know in the industry.
So yes, from our side, emotions are very high. A lot of what I'm hearing out there with regards to how chefs are feeling is my self-worth, not only from a work perspective, but as well as a family perspective. How do my family see me? If I'm the breadwinner and I'm the one bringing in the money, why and how do I actually handle the situation? That's been quite a big topic with a lot of the chefs and especially close friends that have been affected by this. I think when I mention the word closeness, that is where my heart kind of like becomes quite raw and honest, because that's when as a parent that it's real. Having a job, having been able to live through this, and yet knowing that there are so many people out there in our industry that are losing their jobs as we speak. Every single day, if it's not talking to them on a one-on-one basis, it's an email. If it's not an email, it's somebody within our teams that are reaching out because certain operators are feeling the same way. And I find it very hard sometimes to try and understand how they're actually feeling, but yet a lot of the times, and why I say it's hard is because we're all going through it. And yet to try and explain to somebody from an emotional level how you're feeling, you've got to be the strong one for them. And yet when you mention that you've got this Fair Kitchens line that they can speak to someone, they kind of like all of a sudden that anxiety starts building up. I'm strong. I don't need anybody. I can talk to somebody that's close to me, or my family's there, but yet they don't understand that sometimes just speaking to a complete stranger where things are not shared and it's completely confidential. And if you start talking to them more about that, they start understanding, you know what, maybe there is a lifeline out there for me. So yes, that's how I've been seeing it.
I'm going to go to one of our experts in the industry, and I'll go to Claire now with this question. Claire, your guidance and expertise regarding the current situation of COVID-19, what kind of support can you offer and the industry out there?
So when it comes to coronavirus, we're actually dealing with two issues, and you're already becoming aware of that. We're dealing with the medical, physical health threat, and we're also dealing with the mental health threat. And although the coronavirus does represent a very serious medical threat, it's actually the mental health threat that's going to be the greatest challenge for most of us. And that's because our emotional reactions are probably going to last a lot longer than the pandemic itself. And currently, most of our attention is sadly on the physical. And I shouldn't say sadly, because it does need to be on the physical virus. We have put into place lots of measures to prevent contagion, things like social distancing, lockdown, using personal protective equipment, sanitizing, all of that. And it has its place. We need to be doing that. But from a psychologist's point of view, the sad thing is that we are not paying enough attention to the emotional reaction. And it's concerning because you've already heard from the two chefs, how everybody is reacting with some kind of an emotional response. And it's to be expected. The most common responses that we are experiencing at the moment, and this is global, this is not just in South Africa. So I'm constantly having online sessions with my colleagues in, all over the world. And what we're seeing is fear, anxiety, sadness and depression. We're seeing stress, lots of anger and irritability. We're seeing insomnia and disturbed sleep. We are seeing just general emotional exhaustion. People they're exhausted. But of course, we're seeing lots of grief, and that's grief because of the loss of loved ones, but also grief because of all the other losses. You've heard about job losses, business losses, loss of lifestyle, financial losses, and grief is being experienced because of all of those. We're also experiencing something called complicated grief, particularly in some of the other countries where there's been a lot of deaths. Our death toll is rising, as you know. And the complicated grief is coming in because people are not able to even be with their loved ones when they go into hospital. They're not able to say goodbye. They're not able to have the usual funerals and funeral rituals and so on with their support, with their community, with their loved ones. So lots of complicated grief is coming through. And just generally, almost every single one of the clients that I deal with, and I'm working with clients on a daily basis, they're saying things like, we can't concentrate, we can't focus, we're struggling to problem solve, we're struggling to make decisions. There's a long-term risk for self-medication, drug abuse, alcohol abuse. There's a risk of long-term avoidance behavior. So many people are self-isolating, shielding, just staying at home. And there's quite a fear of going out when they are being called to go back into the workplace or, for any other reason. There's an increase in domestic abuse, which you've been hearing about through the news. There's a general loss of productivity, lots more burnout, and very sadly and alarmingly, the suicide rates are escalating. And I mean, that's quite a long list that I've mentioned there. And all of these reactions are actually to be expected because the threat is real. We are having to make significant lifestyle changes. And so it's actually okay to not be okay. Experiencing any one of these symptoms doesn't mean that you're not up to the job. It just means that you are human. So, my kind of appeal is that people don't feel ashamed of their emotions, because their emotions are a normal reaction. They're a normal response to a very abnormal situation. And although the emotions are valid, if we don't manage them, then we could end up with severe mental illness. So that's what we need to be doing. We need to be managing our emotional reactions. And that's the good news, is that we can manage them. We can protect our mental health. We can reduce mental illness. And it's about education. It's about awareness. It's about implementing effective strategies, techniques, talking about it, reaching out for support. We know that all healthy, resilient individuals will use all their resources that are available to them. And the Unilever Food Solutions helpline, this helpline that is on offer, free toll, is an amazing service. I mean, I'm just in awe, and it is absolutely fabulous. And so I'm going to really encourage people to use it, to use that, because there are professionals on the other end. So yes, you can talk to friends, you can talk to community members and get support that way. But anyone has an opinion, and it doesn't matter how educated you are, you can still have an opinion. But the helpline has professionals on the other end of the line that can really help you. And so don't be ashamed to use it, don't be embarrassed to use it, don't feel bad to use it. be one of those healthy, resilient individuals who reaches out and makes use of this really amazing service which has been put in place for you. And it couldn't have come at a better time than for you to be using it right now in this coronavirus situation.
And I was just looking at you've got 20 years of experience, and what are your thoughts in this current situation at the moment?
I think, we got to take into cognizance that everybody has a unique experience. Everybody has their own narrative. Everybody within the food industry or even amongst their loved ones and their family members, we're dealing with a situation that is abnormal. They call it the new normal, but the reality is it is an abnormal situation where you have to sanitize. You have to take care of your safety in terms of physical health. You also have to maintain that work-life balance. And for some of us, even that work balance that we used to prioritize is no longer there. So we feel very anxious. There's also the dealing with lockdown fatigue. People are not knowing what to do to fill those hours. We have children, we have family members, we have elderly amongst us. We have those that want to study, and I see, there's bursary offers, but some studying has come to a grinding halt. And also in terms of our way of life, some of us have put on hold even gathering for functions or social settings. Weddings have been put on hold. And even the restaurant sector, there's a lot of restaurants that are either closing down, they're retrenching, they're downgrading, they're downsizing, and even food security is becoming an issue. So within the scope of various dynamics, we've got to ask ourselves what resources are available to us. And like Claire has mentioned, having this helpline is one of those resources that anybody within the Unilever Food Solutions or any chef or their family members or their dependents can utilize. And having this resource that's available 24 hours and it's free, even if you're phoning from a landline or from a mobile number, the call is free. So if you work during the day or if you are available at night, we are there to listen. And like Claire's mentioned, we have experts that have been trained in this field. It makes a difference when you talk to someone within a safe space and someone that is equipped to explore how you actually feel, to give you direction, to give you coping strategies, and to make sense of what you are actually doing and how you can cope. There are various coping strategies. A coping strategy could be that you come home and all you want to do is shout and scream. That is a coping strategy. But is it an effective one? The answer is no. So it takes time for you to reflect on your self-awareness, where you are and where you can be. And that's why we have this helpline. Furthermore, we have a database of referral sites, not just for mental health, for physical health, for financial stress, for scholastic colleges out there, whether it's anything that's affecting you and your well-being, this is the helpline for you.
Heidi, I'm going to ask you if you've got any real question or not, it's not real concerns that you'd maybe like to ask Anne.
Hi, Anne. So from my side, just listening to what you had to say about the non-effective and obviously the coping mechanisms that one can use. How do you feel this South African depression and anxiety groups, Fair Kitchen's line, can assist those chefs, not even just chefs, I think it's more front of house, back of house staff, staff within the actual kitchen. How do you think that would assist them?
So I think the fact is we have trained counselors that will be able to assist them 24/7. Furthermore, the SADAG has a national presence, meaning that we have resource database across all areas within every our so wherever you're calling from, whatever your name, we will definitely listen. We offer containment, we offer counseling, we offer referral. So in essence, basically, it should be your first line of call. There are protocols that we follow. Obviously, confidentiality is a big one. And when we want to assist your family members, whether, like you said, if you're involved back office, front office, administration, whether you're an actual chef, there is that element where you feel that you've been stigmatized. So we are trying to unbundle that, unpack it, and make you feel safe, make you feel secure, so that you can seek the help that you need. And everybody has a right to do that, because health is a priority. Just like taking care of your physical health, you need to take care of your mental health.
Thank you, Anne. Pinky, are there any questions or relating to the current situation that you'd like to ask Claire?
Claire, what are your thoughts when it comes to the COVID-19 situation, and especially as the numbers are rising and the industry, the hospitality and the tourism industry is opening, the schools are opening? What are your thoughts?
With everything opening, people are anxious. They're very, very anxious to send their children to the schools and so on. And they're anxious for a number of reasons. They're anxious that the children get infected. They're anxious that the children become carriers and bring it home to vulnerable people. As the restaurants and those kinds of public places are opening, there's general anxiety around that, because restaurants are known to be places where a lot of people accumulate. You know, they come together, and even though there will be social distancing put in place, there are fears and anxiety around that. And what I'm going to say is that people need to acknowledge that there is a real fear, but put into place all the physical practices that they can to keep themselves safe. So, do the social distancing. If you're not doing it for yourself, then do it for somebody else. Because there are people who say, well, I don't care if I get sick. The problem is that if they get sick, they become a carrier. And they're not just the only one who's going to get sick, but they're going to then transmit. So put into place all the physical practices that you can to keep yourself and to keep other people from becoming infected. And then just knowing that you've done that, you can kind of calm down and settle down and just trust that you've done everything that you can do.
You spoke, sorry, Anne, Claire, you spoke about fears and anxiety. What would be your advice to advise people that counseling, how can counseling and support help them in dealing with the fears and the anxiety that they have?
So when fear and anxiety is not managed, it will just escalate. It'll just get, greater and greater and greater. And then it has a physical effect on individuals as well as a mental health effect. So the physical effect is, people that are extremely anxious and stressed are far more clumsy. They're far more likely to make mistakes, have accidents, and in a kitchen, you certainly don't want to be having accidents and so on. So you need to be managing it, and the professionals will be able to assist you with that. Talking it through can make a massive difference, talking it through with a professional, but that professional, that expert will also be able to give a variety of tips and skills and suggestions and techniques that the individual can use to manage their anxiety. So things like breathing techniques, relaxation techniques, meditation techniques, mindfulness, as well as other physical techniques that can be brought in, and also looking at what's going on in terms of self-talk, head talk. What are people saying to themselves, and changing, helping people to change their head talk from negative, unhelpful, thinking to more positive and helpful thinking. So the counseling can help with all of that. And
wow, thank you.
Just to add, if I may, just to add to that, people don't know so many of the skills and techniques that the experts can give them. And so it's just a case of drawing on that professional advice.
You just spoke about self-talk. I find that I also do that when I'm stressed out. I'm telling myself, no, I'll be fine. No, I don't need to talk to anybody. No, let me sleep on it. Tomorrow I'll be better. And still, tomorrow when I wake up, I'm actually even worse. So self-talking, from moving from the negative to an optimistic and positive way of thinking, also is a good, a technique to help you with your fears and anxiety. And I think it's a good tip that everybody can use. And thank you for all those tips.
Sorry, just before we close, I'm gonna just quickly hashtag Fair Kitchens. I'd like people to join the movement. For more detail, they can go to www.ufs.com, and the toll-free line, the number is 0800 000 6333. And on that note, I'd like to thank every single one of you for the time that you've given us to make this possible. And and like Claire says, it's okay not to be okay. So thank you very much, ladies.